As we move deeper into flu season, doctors are concerned about a potential tripledemic. Our reporter Ken McCoy spoke with the Alabama Department of Public Health to get us more information. Ken, what can you tell us?
Kanisha, just when we thought we were done with pandemics, tripledemics has made its case. And while we are all at risk, children make up most of the cases.
Cold, flu, and RSV are the three viruses that make up what experts call a tripledemic. And what's worse, you can experience all three in succession.
So the three viruses that people are talking about is influenza, which is typically a late, kind of midwinter illness, usually peaks in January, and it is vaccine preventable. The second one is, of course, COVID-19, which we've dealt with over the last few years, which is still circulating in Alabama. And the third one is the RSV virus. And RSV is a virus that's been around for a really long time. So three respiratory illnesses that can all cause severe disease, can all affect the lungs, all circulating at the same time.
Respiratory syncytial virus, or RSV, is a virus that affects many, but mostly children.
So RSV is a virus that is very hard to diagnose on your own. RSV, flu, and COVID-19 have very, very similar symptoms, and it's not something that's typically tested for in adults, although it can be, and it can cause severe respiratory problems. It's typically something we worry about in very young infants, especially those that were premature or have lung problems, but it can infect anyone and actually can cause severe illness even in older individuals.
With the season at the midway point, healthcare professionals are advising to practice good hygiene habits in order to avoid hospital overcrowding.
So I think, the biggest thing is I would encourage everyone out there is to get vaccines for the things that you can be vaccinated for that can help take some stress off the system. So, making sure that you're paying attention, practicing good hygiene, staying away from people you're sick, getting vaccinated, getting treated if you do get sick, and trying to avoid going into the hospital to create that unnecessary strain on the healthcare system.
While there are vaccines for flu and COVID, there is no vaccine for RSV. So if you or a loved one are experiencing symptoms, please speak with a healthcare professional. Back to you, Kanisha.
All right, thank you, Ken. And you may wonder, how do the symptoms vary between each other? COVID and flu symptoms are very similar, with fever, chills, cough, fatigue, sore throat. The one unique symptom to COVID is the loss of taste or smell. RSV is usually mild with adults and older children, but it can be very dangerous to infants and the elderly.